Hello, ladies and gentlemen. I'm very glad that I'm with you today in your lovely country. Okay. I will present today a combination of autologous PRP and fractional carbon dioxide laser in skin rejuvenation. Skin rejuvenation, what is aging? As all we know, aging is a progressive multifactorial process characteristic of the final stage of the life cycles in which tissues and organic function of the organism decline, resulting in a lower level of adaptation to environmental changes. We have intrinsic aging and extrinsic aging. Intrinsic aging is a gradual decline in function over time. Extrinsic aging is cumulative damage caused by environment factors like smoking, chemicals, UVB, and other factors. Decreased vascularization limited replenishment of cells and the intercellular matrix, skin appendages, disorder, far atrophy, loss of muscle tone. Clinically, we have roughness, uneven pigmentation, telangiectasia, deep wrinkles, neoplasia. Conditions that can be treated with skin rejuvenation or resurfacing included static wrinkles, dynamic wrinkles, pigmentation, scars, vascular condition, loss of skin tone. Autologous PRP. Autologous PRP, they exist in medicine since 1970. They came in our life in cosmetic dermatology since 2008. What is PRP? Most accepted definition is a volume of autologous plasma that contains a platelet concentration above basal concentration 150,000 up to 350,000 per liter. Other definition is that autologous solution of plasma contain 4 to 7 times the baseline concentration of human platelets. PRP contains growth factors in alpha granules and dense granules. Alpha granules contain 7 fundamental growth factors like moderate cells, proliferation, differentiation, angiogenesis, and chemiotaxis. Dense granules is increased membrane permeability and modulate inflammation. How we can prepare PRP? We can prepare by ourselves or with kit. Collection of vein blonde, as all we know, I think. We put in sterile tubes. We put in centrifusion. Low speed avoid PLP fragmentation. And we have 3 layers. 3 fraction of plasma phase. The majority of studies have been contact with pure PRP and leukocyte PRP. Separation in sterile tube, activation of lower fraction with calcium chloride or thrombin, or and with hyaluronic acid, injection within 10 minutes and Zoll until formate heating bioactive polymers. Its safety? Yes, it's safety. If there is no disease transmission, if there is no evidence of oncogenic potential, or no evidence of systemic effects after local application. Quality requirements in sterile test, product traceability, follow-up, and kit, it must have CE. Where we use PRP in dermatology? In dermatology, we use PRP in acne scars, in skin aging, in alopecia, in skin flaps, in skin ulcers, and in hydroquinides separated. In vivo studies have shown that PRP exercise a bioregenerating action through stimulation of fibroblast proliferation, procollagen 1, increased dermal resistance to tension and stretching, hyaluronic acid creating lubricating action, good hydrating agent, and I'm sorry. And tissues inhibitor metalloproteinases 1 stabilize an extracellular matrix. Applied topically or by intradermal injection. We have platinum-rich plasma and platelet-poor plasma were prepared using a double spin method and then activated with thrombin and calcium chloride. The proliferative effects of APRP and APP were measured by 3,8-thymidine incorporation assay, and their effect on matrix protein synthesis were assessed by quantifying levels of procollagen type 1 carboxy terminal peptide, PIP, by ELISA. The production of collagen and matrix metalloproteinases was studied by Western blotting and reverse transcriptase polymerase chain reaction. Of this, we have result platinum numbers in PRP increase to 9.4-fold over baseline values, APRP and APP. Both stimulated cell proliferation, with peak proliferation occurring in cells growth in 5% IPRP. Levels of PIP were highest in cell grown in the presence of 5% APRP. Additionally, APRP and APP increase the expression of type 1 collagen, MMP1 protein, and mRNA in human dermal fibroblast. Only 6 of 20 randomized clinical trials reported the treatment-related adverse event. Overall, all studies agree that there were no treatment-related complications. 2 of them included the type of adverse event. Driver and co-workers showed an increase in the blonde area nitrogen in the control group and an increase in either the thrombin time or the activated partial thromboblastin time was observed in both treatment groups, PRP and control. In the study by Sennett and colleagues, 2 patients reported dermatitis, 1 in each treatment group. 1 patient developed an infection in existing ulcers, and 1 had thrombophlebitis, both in the PRP group. And now in fractional laser. What is fractional laser? Fractional CO2 resurfacing. Skin resurfacing refers to the removal of the outer layers of photo-damaged skin to stimulate re-epithelialization and collagen remodeling. Aesthetic procedure of resurfacing facial skin may be surgical or non-surgical. To address the adverse effects of ablative laser and limited efficacy of non-ablative laser, is a fractional photodermolysis was developed. The laser beam creates an area of microscopic woods and specific depths of the skin with controlled collateral damage to the surrounding tissues, and product microablation, tissue contraction, neocollagenesis, and rapid healing, caused by small woods and the short migration distance for keratinocyte during re-epithelialization. Variable degree of elevation in inflammatory cytokines, type 1 procollagen, type 3 procollagen, growth factors, and MMPs 1, 3, 9, and 13, collagen remodeling occurs for at least 3 months, skin tightening and improved texture ablative more than non-ablative, 25% mean increase in dermal thickness, results confirmed by histological evidence. Softening of disappearance of mild to moderate retides, improvement of skin texture and tone, degrees of pore size, reduction in skin laxity. Contraindication. We have contraindication if we have active infection, appendageal abnormality, concerns or recent oral retinol more than 6 months after cessation, skin grafts, of course if we have unrealistic expectation, keloid scarring history, regional resurfacing in darker skin or individual, previous deep chemical peel, history of cold sores, prophylaxis wait for full epithelialization. Pre-treatment, 1 day before, we give prophylactic antibiotic and antiviral medication for 7 days. 1 hour before, we give ketorolac 16 mg per os or diazepam 5 to 10 mg, and we we apply a topical anesthetic. 15 minutes before, we made the nerve blocks, and immediately before treatment, we put anesthetic eye drops and protective metal eye seals. Immediately after, we put application of gauze soaked in ice cold water and alcohol healing ointment and protective sterile mask. When patient goes home, as above until resulting of crusting, he applied non-greasy moisturizing cream and sunblock. We made follow-up after 2 days, 1 week, and 1 month. Re-epithelialization with fractional CO2 laser takes 3 to 6 days healing by migration of neighboring cutaneous stem cells. Traditional CO2 laser system takes, for full resurfacing, 2 to 3 weeks heal by migration of stem cells from hair follicles. Very few adverse events, very few infections like herpes zoster virus, bacteria, candida, few days of occlusion ointment application, reduced rate of acneiform eruptions, erythema resolves much more quickly in traditional ablative CO2 laser treatments, persist for up to 3 to 4 months post-treatment. Pigmentary change, reduce scarring probability. Here in this slide, you can take after, we have some degree of severity. We have mild, moderate, and severe.
2 more minutes.
Okay. Okay, combination. Okay, thank you. Okay, okay. Combination of autologous PRP and fractional carbon dioxide laser in skin rejuvenation. In this study, 22 women with dark phototypes were randomly assigned to receive combined PRP and fractional laser treatment or fractional laser treatment alone. They received 3 sessions and measurements were made before first treatment and 1 month after the last. When the improvement score in both groups was objectively assessed by comparing photographs, no statistically significant difference between them was found. On the other hand, the subjective satisfaction scale of the patient treated when skin texture and elasticity were assessed varied significantly in the PRP and fractional group, as proportion of patients state that their skin texture was improved or much improved, while none in the fractional laser group report much improvement. Unfortunately, I will pass all this, and I was coming. I'm sorry. Okay, this is a histological. Okay. Some of my case. And key points. Skin rejuvenation is an aesthetic procedure used to reverse signs of aging. Platelet-rich plasma has been proved to enhance wound healing. PRP contains growth factor that can stimulate fibroblast proliferation. PRP has been proved to be a safe treatment. Publications support good results in skin rejuvenation, but there is a lack of well-designed study to assess the efficacy of PRP. Fractional CO2 laser is one of the methods used for skin resurfacing. Inflammation induced by this device result in collagen remodeling, skin tightening, and improvement of skin texture. Fractional CO2 laser is safer compared to traditional device. Combination of fractional CO2 laser and PRP yields mixed results in few existing publications. Histological analysis of treatment areas show statistically significant improvement when the combination of treatments is used. Duration of side effects is shorter when complication of treatment is used. There is a need for more extensive and better design study to assess the efficacy of combination treatment. Thank you very much for your attention. And I'm sorry that I take a lot.
Thank you, Dr. Almapnopoulo. It is a big, big, big
Yes,
topic.
because it was
I know, but
yes.
it was very nice presented.
Okay, thank you
Any
very much.
questions? Yes.
I think most of us would like to know, how did you perform this combination? After the CO2, did you supply PRP?
Yes, after CO2. First first you made CO2 laser or Fraxel laser, what we have, and after that you apply the PRP. Injective. I made injective.
The lady,
Injectable.
the lady there, and then you. You are very far away.
I don't understand you. Can you repeat? Between the session, 20 days, 15 days, 20 days. The same day, in the same session, in the same day.
Another question?
No, I use and I prepared by myself, but I use a kit with CE.
When you inject,
Yes, and you can mix and with hyaluronic acid.
Any other question?
when you inject with the PRP after the laser session, when you inject the PRP after the laser session, the patients find it a little painful. I mean, it's much more painful than when you do it.
If you prepare patients in the same way that I write here, no, they don't feel nothing.
Ayamla?
Yes, you put a topical, you put a nerve block, and you don't put nothing.
Okay. Any other question? The last.
Downtime.
No, not you. This gentleman. There. Oh, I saw it.
Yeah,
Any other-
you said you do a double spin. So how many RPM and timing you do for the first spin as well as the second spin?
Oh,
And the type of centrifuge you use, is it a cold or the normal one?
normal. Normal.
Yeah, now spin. For the first spin,
Three-
how
three-
much is the RPM and the timing? And for the second spin, how much is the RPM and the timing?
5 minutes. 5 minutes.
RPM? Rotations per minute?
Yes, 3,000. 3,000.
For both the spins?
Yes,
And 5 minutes for both the spins?
yes.
Thank you.
Okay. Thank you very much.